Hello, everybody. I'm Dr. Dana Maddox. I work at the Institute for Health and Healing for Sutter. When I work and when people come into the office, I look a lot at their postural issues. And one of the biggest areas I like to start with is their feet. Regardless of what issues they come in for, feet are very, very important to me because they are the foundation of how the rest of our mechanics in our bodies function. A lot of us have feet issues because of the fact that we wear shoes the majority part of the day, which we're not designed to do. As humans, we're designed to use our feet functionally. We're designed to use our feet outdoors. We're designed to use our feet to climb up things. And when we wear shoes throughout the day, we are, in a sense, really putting a cast on our foot. And when you put a cast on any area of the body, what you end up doing is atrophying the muscles and inhibiting joint motion, so the joints are allowed to move to their full range of motion, which ends up causing other problems. Not necessarily pain, but it could cause mechanical problems in how the toes, the joints in the feet, the ankles, the knees, the hips, the back end up working. And if the low back ends up working not correctly through the mechanics, then it can end up affecting the neck and the shoulders. So for me, foundation, just like anything, just like as you build a house, any foundation is the key to how everything above it's going to function. So inside the foot, there's 30 joints, there's over 100 muscles and tendons, and 26 bones. So between all those, the mechanics of them can be very, very complicated. And how they're actually being used. So when we end up wearing a shoe and we cut those off, what happens is that the brain's also not perceiving how our feet are working. It's not perceiving how those joints are working. And so when we decrease the brain's perception of how the foot's working, we're also decreasing the brain's perception of how the knees, the hips, and the rest of our spine is working in relation to how we walk and how we move. So looking at foot posture for me, what I look for is to see if the toes are really kind of stuck together, if there's any separation in the toes when the foot goes down. I'm going to show you with my hands and then I'll show you with my feet in a little bit. So if everybody wants to turn on their video, you can kind of see how I'm explaining how the foot's supposed to work. So I'm looking for toe separation, and I'm also looking to see how much what we call pronation of the foot's happening. Some people call this fallen arches, and how much the arch are falling down, and how much the bones are actually sliding over the ankle. So for me, when I see that, that's a big key factor in how much weakness we have inside the foot. And when I see that weakness, I do give exercises, which I'll be showing you a little bit on how to strengthen it. So when we have that pronation, or that the foot's falling in and we've got those weak muscles inside the feet, what ends up happening is we get a little bit of rotation inside the legs because the arches are falling in, which causes a slight distortion in the pelvis, how the pelvis is being used, and it ends up having low back pain. A lot of people end up having low back pain because of this. Maybe not the beginning, but maybe after years of having improper mechanics within the feet and the knees and the hips, people end up having some sort of joint problems. I would have to say I probably find this on around 98% of my patients that have weak feet and problems with their low back. The other 2% that I don't find that in are people that usually have a tendency to go around barefoot. They are already wearing functional shoes for foot strengthening. And a lot of times they end up being a lot of my athletes that are already have a basic understanding how foot strength works in towards athletics. But the majority of us, we wear shoes all the time, so we do have this problem with the atrophy muscles and weakening of those muscles and decreased strength inside the arches. Some people do have manifestations of how this weakness in the feet presents. Some people actually have plantar fasciitis. Some people do have bone spurs. Some people do have what they call the valgus toe, where the big toe kind of pulls in. And those are all big signs of having this weakness inside the foot. So looking at the foot, a lot of people, they don't really understand how it's really relating to the low back or how it's relating to their mid back and their neck. But but when, we talk about how the functionality of the foot's really supposed to be, a lot of times we get this understanding that to be have a good functioning human body, we have to have everything functioning well, not just our arms and our legs, but we need our feet functioning well. And the way we were designed to do that as children, it was to learn how to walk barefoot, to go around barefoot. And it's not always just a barefootedness even in the house, but this also means going barefoot outside. So most of the input that goes from our feet up into our brains, a large percentage of it is sensory. So that means being able to walk across grass, being able to walk across sand, even pebbles. Sometimes people, they say they have tender feet because they're unable to walk across surfaces where there's a little bit of, stones underneath that might give them a sensory input that would hurt. But we are physically designed to be able to walk across those surfaces and not feel pain. So having that what they call like a sensory deprivation of the feet, where we're unable to walk across these surfaces and be able to tolerate those things, means that there's a little bit of a the sensory input from the feet up into the brain is a little bit heightened than it shouldn't be. So when we have that sensory input from the foot, so if you walk across, let's say some gravel, if you're walking across gravel and the brain senses the gravel underneath the foot, what it does is it starts firing the muscles inside the foot and in the ankle to stabilize the foot and ankle in order for the body to move. So without that strong sensory input from the foot, that it's able to handle different surfaces, that also inputs to the muscles in the feet and the joints to how we're actually using our ankles, our knees, and our back. So walking tenderfooted or always wearing a shoe, what happens is you end up walking with a foot where the joints aren't moving, and a lot of times what we call the gait or the mechanism of how we walk isn't used properly. So a lot of people, they end up using like their whole foot as they walk. And sometimes you see that in children when they wear shoes for the first times, or dogs. They do this little prancing thing. They're actually not using their joints properly because they're not getting the sensory input from the foot. So they end up doing this more flat foot stepping as they walk. Whereas somebody that has really good sensory input from the foot and are able to use the muscles because that sensory input from the foot, use their feet better mechanically, and therefore their knees, their ankles, and the rest of their body. So I'm going to show you a little bit of what I'm talking about on my feet. I'm going to see if we can angle this down a little bit. I'm going to stand up. And I just want to show you all what I'm talking about. Is that far back enough? Let's see. We got a good angle. Maybe when you get the screen back there. There we go. Okay. So when I look at the foot, and as the foot's being put down, I go to check to see, number one, are the toes spreading apart when the weight's put on them? So that kind of looks like this. And the next thing I look for to see how well the foot's functioning is how much control do we have over those muscles of the foot. Is the person able to tap the toes? Are they able to move the toes individually? Two toes in particular individually, I would say the big toe. The big toe should have this capability to move back and forth. When you have a valgus toe, and I'll show you what it looks like because I used to have a really bad one, is bringing the big toe over the side. It's hard to use the muscle that attaches to it, and that's the one that causes the same motion in our thumbs. It's called abductor hallucis longus, and it causes that motion in the big toe back and forth. And then we have a smaller one in our pinky toes that causes sideways motion too, just like in our hands. So those muscles all go to stabilize the arch of the foot. And I'll show you. So when we move the big toe over to the side, we get a stronger angle in the foot. So as I move my toe to the side, which would be a part of walking, is when we walk, our toes go to the ground, they spread, and they kind of hold the ground when we walk, which enables us to stabilize the muscles in the arch and in the ankle in order for us to move our feet. So if you want to check out your own toes to see how they move, one thing you can check out, see how far you can bring them up, see how much individual motion do you have in each toe. So being able to do toe tapping. Some of the toes won't separate out because they do share common tendons, but being able to exercise, being able to try to separate them out and getting some coordination in the toe is a really good way to start strengthening the foot out. The next one is is how much strength you have in your toes. So spreading them out and being able to grip the ground with the toes is also another way to end up stabilizing the foot. So one thing I like people to go and look at, and one way that I've seen how we are really designed to use our feet is going back and looking at old anatomy, especially stuff from about 400 years ago. When you see old Roman statues of gladiators, when they depict the human foot in anatomy, they always depict it with the toes spread and toes gripped. And we don't usually have that posture anymore, especially our athletes, because we do wear shoes all the time. So trying to get into that posture again whenever we're standing and doing stuff, just having the toes spread, toes gripped, ends up really stabilizing all the muscles in the foot, especially that arch, which end up giving us foot strength and ankle strength again. So toe tapping's one, and that big toe, I want to get back to that big toe, because that big toe and that muscle there is one of the thickest muscles in our feet that ends up stabilizing the arch of our foot. So there's some research that says that the strength of the big toe can be an indicator of risk of fall and fracture as people get older. So that, in a huge sense, also tells us what kind of risk we are for all of our joints, not just our fall and fracture, but how all of our joints are functioning. Because if our big toe is a big stabilizer of how we're moving our body, it also means that the rest of our joints aren't moving well either. So I'm going to show you another exercise that I usually use with a towel. I call it a short foot exercise. And what this exercise looks like is we get one foot on a towel. I usually use a hand towel for this exercise. And again, it's a spreading of the toes, gripping, and then trying to pull the towel or cloth underneath the foot. So what this does is this works what we call the flexors of the foot to end up strengthening the arch. While this exercise is being done, if you can add in trying to get the big toe to reach and grab the opposite corner of the towel or cloth, we'll end up exercising that coordination of that big toe in order to reach and grab, which was that muscle here that ends up stabilizing the arch. So the exercise looks something like this: spreading and grabbing, reaching with the big toe, and making sure that you're not turning your foot in to grab the corner of the toe or the corner of the towel, but really trying to reach and grab and pull the cloth underneath the foot. So those are two basic ones. And the other one I like to get people to in order to strengthen the foot is going up on their tippy toes, usually holding on to something, spreading, gripping with the toes, and then coming down on the foot. So the gripping activates those muscles in the bottom of the foot, which ends up strengthening them, and going up and down. This is kind of like doing a calf raise. If you go to the gym and you do any exercise inside the gym, this is what we call a traditional calf raise. I like to do those barefoot in order to strengthen the plantar arch, which works together with the calf. So doing plantar raises, which I like to call plantar raises, really ends up giving a lot more strength into the arch and the ankle, because we end up strengthening the outside musculature, which are the extensors of our toes, which cause them to go up. It ends up strengthening the muscles in the outside of the ankle, which ends up stabilizing the ankle well. So when you walk, you end up having a really good mechanical traction of the ankle. So the spreading, the gripping, going up, it stabilizes the ankle. And the mechanics, when that's done really well, will end up stabilizing also the knee joint and then the hip. So some other recommendations that I usually have for people in order to strengthen the feet are, one, I already said, walking around, getting sensory input from the foot, walking across grass, the sand and gravel. I like people to start going barefoot in the house. Some people have a hard time doing it. So a simple thing I like to recommend is people getting yoga socks, so the toe socks, with the ones with the toes cut off, so you actually have some sensory input into the toes. And what that ends up doing is it gives you a little sensory input, but that little slight separation inside the toes helps to activate, I'm showing you on my hand, pretending it's my foot, but helps you activate the interosseous muscles of the toe. So with those slightly activated, with that little bit of separation when you walk, it helps to strengthen the feet too. And then the next thing I like to recommend people to get is to use 5-finger shoes. 5-finger shoes will mimic a little bit of how a person goes barefoot. They are not for everybody, so it's not an easy jump to go from wearing shoes all the time to going over into using something as they call minimalistic shoe. It's 5-finger shoes. You do have to go very slow if you've been wearing shoes for a long time to start going barefoot or wearing 5-finger shoes. because sometimes strengthening the muscles too fast inside the feet can end up causing ankle pain and knee pain, especially if you've already had plantar fasciitis or you've already had foot problems in the past. Trying to do a lot of these exercises, jumping into them, will end up changing a little bit of the mechanics of the feet and the knees and could cause some pain. So with these exercises, I always say to go slow and easy with them, especially the 5-finger shoes. But what the 5-finger shoes do, they do a little bit more than what the yoga socks do. So they do a really good job of separating the toes out and being able to walk outside on multiple surfaces, going on walks in those shoes. What happens is that the toes are allowed to function properly. There is no arch support in them, but this is the whole point. So an arch support is a little bit of a better cast as a shoe. So it holds your foot in a proper posture, so your mechanics are better, your back is in a better positioning, but it causes weakness of the foot. So the 5-finger shoes, what it does is it separates the toes out and allows those muscles of the plantar arch to work functionally, so they're actually working as you walk. But it takes time, just like going to the gym. It takes a while to build up muscles and have the brain understand how those feet are functioning now with the rest of your mechanics. So I recommend people getting those shoes and using them just at home for a month to 2 months, and maybe after 2 months of getting the 5-finger shoes, to start wearing them on small trips out to the store, wearing it, or out to the park, or small walks. And maybe within 6 months of wearing the 5-finger shoes, to be able to walk and wear them going on hikes, 1 to 2 miles at a time. This is even more so for anybody that's an athlete, because a lot of athletes have a lot of mechanical information that has already come up from their bodies. So their joint proprioception is usually really strong already, and it takes a lot more to strengthen their feet and rehab how their feet are being used within the rest of their mechanics, and they run into more risk of having knee problems and hip problems by wearing minimalistic shoes or 5-finger shoes. So a lot of them, I have them go in a little bit slower in doing these things. What happens when you end up strengthening the foot after having a really strong deconditioned foot for a long time is that the rest of the mechanics end up changing, and how the posture of the low back ends up changing too. So when the feet are strong, what happens is that we start using different muscles even in our pelvis, our hip flexors, and our hip extensors, which end up stabilizing the back the way it was designed to be stabilized, which is through the foundation of having strong mechanics in the feet.